Critical ADHD medication shortage, black market concerns. ADHD med shortage in Australia, causes, impact, and what you can do. Critical ADHD medication shortage, black market concerns. Imagine waking up one day to find that the medication you rely on to manage your ADHD is suddenly out of reach. This is the stark reality facing hundreds of thousands of Australians as a critical drug shortage looms large. The situation is dire, and it's sparking fears of a black market emerging to fill the gap. But here's where it gets controversial. Some people might turn to amphetamine-based alternatives, while others could be forced to pay a hefty $200 for non-subsidized drugs. And this is the part most people miss. The ripple effects of this shortage could extend far beyond just financial strain, impacting mental health and overall well-being. Let's dive deeper into this pressing issue. For those who depend on a specific type of ADHD medication, the options are now severely limited. They either have to switch to amphetamine-based alternatives, which might not be suitable for everyone, or shell out a significant amount of money for non-subsidized drugs. This financial burden can be overwhelming, especially for families already struggling with the costs of managing ADHD. But the implications go beyond just the wallet. The stress of finding and affording the right medication can take a toll on mental health, exacerbating symptoms and creating a vicious cycle. The fear of a black market emerging is not unfounded. Desperate times often call for desperate measures, and people might turn to unregulated sources to get the medication they need. This poses serious risks, including the potential for counterfeit or unsafe drugs entering the market. It's a slippery slope that could have far-reaching consequences for public health. But here's a thought-provoking question: should the government step in to subsidize these critical medications, ensuring that everyone has access to the treatment they need? Or is this a case where the market should be left to find its own solutions? The debate is heated, and opinions are divided. Some argue that subsidizing these drugs is a necessary step to protect public health, while others believe it could lead to over-reliance and misuse. What do you think? Should the government intervene, or should the market be left to its own devices? Share your thoughts in the comments below. Your voice matters, and your insights could help shape the conversation around this critical issue. Let's keep the dialogue open and honest as we navigate this challenging time together. ADHD med shortage in Australia, causes, impact, and what you can do. Attention! A significant shortage of ADHD medications is causing concern and uncertainty for many, a situation that is more complex than it first appears. Recently, it has come to light that several widely used ADHD drugs are expected to be in short supply until the end of the year. This means that numerous individuals across Australia might experience difficulties when their pharmacies attempt to fill prescription orders. But here's where it gets controversial: why exactly are these essential medications running low? According to experts, the root of the problem involves a complicated chain of issues. Professor Dave Coghill explains that the shortage primarily stems from two factors. First, there is a supply hiccup with the raw ingredient, methylphenidate, imported from the United States, a key component in popular drugs like Ritalin and Concerta. Second, there has been a notable increase in ADHD diagnoses, further straining the available supply. He emphasizes that this is a global dilemma, remarking, "It's actually a very complex supply chain problem." There's no malice, and I think the companies that make the medication are quite embarrassed that they aren't able to fulfill their demands. This situation does not affect everyone equally. Although estimating the number of impacted Australians is challenging, since not all individuals diagnosed with ADHD are medicated, it is believed that more than 1 million Australians live with this condition. Professor Coghill, who serves as the president of the Australasian ADHD Professionals Association, notes that while less than 1% of the total population taking these medications may face issues, even that small percentage translates to a significant number of people. So, what steps should you take if you find yourself unable to obtain your usual ADHD medication? First and foremost, stay calm. The supply shortage specifically pertains to methylphenidate, meaning that alternative medications are available and can be equally effective. If you're experiencing difficulty, your initial move should be to consult your prescriber, whether that's your psychiatrist or your child's developmental pediatrician, to discuss your situation. Professor Coghill advises, talk to your prescriber, talk to them quickly. Don't leave it lingering. People with ADHD are very good at procrastinating. He reassures patients that prescribers almost always can devise an effective alternative management plan. John Kramer, who chairs the Royal Australian College of GPs ADHD, ASD and Neurodiversity Specialist Group and holds credentials as both a certified prescriber and GP, concurs with this strategy. He points out, all prescribers will now be aware of the problem, you'd have to be living under a rock not to know about it. Kramer stresses that for existing patients, there is a professional obligation for prescribers to act promptly to ensure continued care, even if it means temporarily prioritizing established patients over new ones. But what if you still find it hard to access your regular specialist? There's no need to panic. Dr. Kramer suggests that your regular general practitioner, GP, can also provide critical support in these circumstances. Even if your GP isn't your primary doctor for ADHD, they can still offer advocacy and potentially contact the relevant regulatory authority to secure a temporary supply of medication on an individual basis. As he explains, if a patient is completely out of their usual medication and cannot secure a timely appointment, a compassionate and flexible approach by the regulator may be warranted. Another point to consider is whether tapering off your dosage might be a viable option. Generally speaking, reducing or stopping your medication on your own is not advisable. Even though Professor Coghill notes that adults with ADHD can make their own informed decisions and that there are no particularly harmful withdrawal effects, maintaining treatment during this shortage is typically the safest and most effective course of action. He reminds us that ADHD affects various areas of life, impacting school, work, and even family dynamics. Ensuring a consistent treatment regime might help in keeping everyday challenges at bay. What do you think about this approach? Is the prioritization of short-term solutions by healthcare providers enough, or could the system be doing more to address such shortages? Share your thoughts or concerns in the comments below. This is the kind of discussion that might lead to more transparent and proactive solutions in the future.